I'm here at VillageMD at Walgreens in Chicago today with Dr. Clive Fields, co-founder of VillageMD. Thank you for being with us, inviting us. I'd love to find out what you think about the future of healthcare. What are the challenges and opportunities? And how do you see VillageMD and Walgreens solving the problems today in healthcare?
Yeah, so that's a great question, Sandra. Thank you for the opportunity. So one thing we know is that there are lots of challenges in healthcare, and with lots of challenges come opportunities. But I think when we look back historically at what's worked well in healthcare, we know that doctors and patients who have a longitudinal relationship based in the primary care services live longer with a higher quality of life and ultimately spend less dollars on the healthcare that they consume. So what we believe is the VillageMD primary care offering or primary care partnership with Walgreens will take two of the places where patients get most of their primary care physician and their pharmacist, where they receive education and prescriptions, and put that in one place. People have heard me say this before, but it's a lot like apple pie and ice cream. I mean, they're both terrific, but when you put them together, it creates something that's better than either one individually. We believe that these Village Medical locations at Walgreens, surrounded by all of the other capabilities like Village Medical at Home, the analytics that help us risk stratify patients likely to need care in the future, a team-based approach that includes nurse practitioners and physician's assistants and pharmacists. We think ultimately that team-based approach coming from the ground up, focus on the primary care needs of a population, will be one of the opportunities and one of the challenges. But if done well, we are confident that this partnership will drive better results for the populations that we take care of.
And of course, you mentioned that healthcare is very difficult today for patients. And how do you see yourself making it totally easier for them?
Yeah, so I'm a patient and I have two elderly parents, so I'm well aware of the friction that's been created in healthcare. And I'm not going to suggest that Village and Walgreens is going to remove all of that friction, but we are going to remove the friction that impacts our patients in the locations where we work. So I think a little bit about the number of times that patients have to go to the pharmacy to get multiple prescriptions, and how working with our Walgreens partners, we can synchronize those medicines so they're all filled at the same time on the same day and reduce unnecessary trips to the pharmacy. I think about our ability through a collaborative care agreement to do formulary substitutions and gap refills so that patients are more adherent to the medicines that they're prescribed and don't run into all of the problems that happen when a patient gets to a pharmacy a minute, a day, or a week before the prescription gets to that pharmacy. We share information in a common medical record that allows the pharmacist to see not what was done 90 days ago through claims, but what was done 90 seconds ago in a clinic only feet from where they're dispensing medications. So there's no question that working with our pharmacy partners and working inside a longitudinal relationship with a primary care doctor, that much of the friction that patients experience on a daily basis when they access our healthcare system can be avoided.
Well, thank you so much for sharing your thoughts and all of your challenges and how you're going to solve the problems for our healthcare system.
Thank you very much, Sandra.
Thank you.